live!
Hello everybody, Dr. Garrett Weegriff here at Pure Plastic Surgery. Thank you for tuning in to another edition of Thursday Thoughts. Sorry I missed you all last week. I am back, we're back in action. Please go check out our website, pureplasticsurgery.com. You can do a virtual, or you can sign up for a consultation there. And also check out, for a short time, we have some specials going on, which is going to stop soon. So currently it's booked before the end of February. You're still, you can still get those specials. So take advantage of that right now. And that's it. All right, we're gonna go over some questions about liposuction now. So I had a couple direct questions and then some other ones that we're gonna go over that were previously sent in. And so one was, when I do vaser liposuction, am I also doing regular liposuction or traditional liposuction? And yes, there's some people that do vaser alone, but it's not actually removing all those little fat cells. So what is vaser? It's the ultrasound technology that helps break up fat and separate it from the connective tissue that's underneath your skin. And so it's really effective at breaking up that stubborn fat, removing it from the connective tissue, also shrinking some of that connective tissue to give you some degree of skin tightening. It also decreases your amount of blood loss. But then after that, we need to do the traditional liposuction, which is actually sucking the fat out. And so yes, I always do that when I do vaser. Next question is, what is Lipo 360 and how is it different from traditional liposuction? So Lipo 360 technically is traditional liposuction. It's just the areas that we're including with it. You know, 15, 20 years ago, it wasn't very common for people to do multiple areas of liposuction at one time, and it's become much more common to do multiple areas of liposuction at one time to give a much more dramatic outcome with the contour of your body. So Lipo 360 basically is a broad term that helps the abdomen, flanks, and back, and then you can add plus or minus different areas on top of that. So who's the ideal candidate for Lipo 360? This is anyone that does not have a lot of loose skin, that has mild skin laxity, or no skin laxity, and just has some stubborn fat around the midsection that really wants to get rid of that. These are, you know, the people that have been working hard in the gym and other things, and they just can't get rid of that stubborn fat. Liposuction is really effective at targeting those areas. You know, people always talk about targeting areas from working out, this and that. You can't really target where the fat is removed from. Your body kind of diffusely removes it from the whole body. So to target an area to remove fat from, liposuction is a great tool to help you with that. What are the benefits of Lipo 360? So, like I just said, retargeting those areas that are very stubborn, and it's the whole effect of getting the front, back, and sides that gives you that dramatic improvement with the contour of your body, both in and out of clothing. How long does it take to see the final results of Lipo 360? So you'll see results pretty much immediately, but the final results are going to take 3 to 6 months. You know, it's pretty profound changes at 3 months, and then 6 months are basically the final results of what you're going to get. But this kind of leads into one of our other questions. It was, how can I maintain my results of Lipo 360 long term? And just like anything else, you can't use this as a weight loss surgery, so you're going to need to maintain a healthy diet and exercise routine. And also, this is one of those fairly labor-intensive procedures from the patient's perspective during the recovery period, because what I can do in the operating room is compounded by what you do in the recovery period by getting your massages, wearing your garments. That really makes a huge difference in the total outcome of this procedure. So those are the things you can do to help maintain it. How long does Lipo 360 surgery take, and what anesthesia is used? So it's different for different people depending on how much we need to remove, but typically an hour to 2.5 hours is the average time for a good thorough Lipo 360. And it can be done under local, but I don't do that. I think it's very uncomfortable for patients. There's risk associated with the amount of local anesthetic we need to use to do that somewhat comfortably. And so I do all of these cases under general anesthesia. I can be much more thorough with the liposuction when we do it that way.
Can I read a message?
Yes.
So excited so excited for my upcoming procedure with Wiggerif.
Awesome. Love it. Can't wait to see you. I don't know what month you're coming, but I hope it's soon. Can Lipo 360 be combined with other cosmetic procedures like Vaser, Body Tight, Avelli? So yes, it can, and we often do that. Like I mentioned earlier, Vaser is a great adjunct to traditional liposuction to decrease blood loss, decrease bruising, increase the amount of fat we're able to remove. And then same thing with Body Tight. Body Tight is a radio frequency energy device that's used in combination with traditional liposuction to also tighten the skin. Avelli is our treatment option for targeting cellulite, and that is a great thing to do at the same time as liposuction. I don't like to do too many of those Avelli areas with fat grafting or BBLs at the same time, because that can lead to different problems, but doing Lipo 360 and that at the same time is a great combination. All right, and then that's pretty much all of the questions. Do we have...
There, but I have here.
All right, let's see what we got.
Okay, where are you located?
We are in Miami, Florida. Come see us, pureplasticsurgery.com.
Close to the Dayland Mall, dog. TikTok's
Yes.
on fire. 986.
Ooh, what's up, TikTok?
999. So you're on fire there. And at TikTok, there's a question. It's personal. How tall are you?
I'm 6'4".
And how tall is Willie?
Oh, I don't...
5'4".
5'10".
5'4". Okay. Remember the patient that said that she's
Yes.
coming? She's coming in January for a drainless tummy tuck.
Awesome.
What should I expect the day of the procedure and the immediate days after?
So the day of procedure, you're going to be up walking around. I want you to do that, require you to do that, because that decreases your risk for developing other complications like DVT or PE. So you're going to have a little bit of discomfort, but you are going to be up and walking around, and I encourage you and want you to do that.
Great. Okay. Another patient, she said, hi.
Hello,
in
hello.
Spanish, hola.
Hola.
And that's okay. What problems occur when doing fat grafting and lipo? So the most common
so we have all
problems.
sorts of things that can happen. But overall, this has actually very safe procedures when done in the right hands. But like any surgical procedure, risk of infection, bleeding, and contour irregularities or lumps and bumps. But again, this is very safe when done in the right hands, and like we do for all of our fat grafting cases, everyone here at Pure Plastic Surgery, we use ultrasound guidance to make sure we're injecting in the right plane. We have not had any pulmonary embolism related to fat embolism with fat grafting at Pure Plastic Surgery.
Doc, the other patient that said, hola en español, she said en español, voy con usted en enero 8 para un mommy makeover. So she's coming in January, the 8th, for a mommy makeover. And the last question, Doc, on TikTok, because it's on fire, 1,500 likes at the moment. And how bad are back lifts? Like a tummy tuck for the back?
So,
yeah,
back lifts are great procedures. The difference is that scar doesn't really hide down in your underwear line, but it does hide where the bra strap goes. So if you want an upper back lift to help get rid of those stubborn rolls in your upper back, it's a great procedure and people do really well with it. And it really improves your contour, and that scar hides within the bra strap. All right, everybody, thank you so much for tuning in. Have a great week. Have a great holiday. Happy Thanksgiving to everyone. And again, check us out at pureplasticsurgery.com.
And see you in 2 weeks. No, next week.
Yeah. I'll be celebrating Thanksgiving with the family. See you guys after that.